All right, so we're going to go over seborrheic keratosis in this video. So you can see from this power a relatively well circumscribed and symmetric acanthotic lesion. You can see some pigment from this power. As you go in on higher power, you'll start to appreciate that the pigment is kind of scattered throughout, some in the bottom part of the lesion, some in the middle part, some at the top of the lesion, just kind of heterogeneously spread out through the lesion. As you go up on higher power, you'll notice that most of the cells that make up this neoplasm are pretty monotonous. So they've got small, compact nuclei with mild to moderate amounts of just cytoplasm. Some of them has a little bit of clear cell change to it. And then you'll see these well-defined milia-like cysts with this eosinophilic keratin in the center, surrounded by some bland-looking keratinocytes around the edges. So this architecturally should make you think about a seborrheic keratosis, given that there is a lot of pigment. This would be a pigmented or heavily pigmented seborrheic keratosis clinically as well. And it's just important to kind of rule out significant atypia in these lesions. Everything looks pretty homogeneous here. Someone might confuse it, a beginner might confuse this with some type of squamous cell carcinoma in situ just because it looks hyperplastic. There's a lot of cells. However, you usually do not see this type of cystic change kind of spread out throughout the lesion. These cells are very homogeneous. They're not very pleomorphic. They're pretty monotonous here. So this is a pigmented seborrheic keratosis. Moving on to another example of a seborrheic keratosis, this could be a little bit more tricky. You can see that it's a well-circumscribed, pretty symmetric lesion. You see, again, those milia-like cysts spread throughout. So architecturally, it's enough for a seborrheic keratosis, but there's some differences with this one. This one's a lot more inflamed. So you see lymphocytes kind of down at the bottom of the lesion and percolating up into the body of the lesion. You can also see these whorls, these squamous eddies of kind of glassy keratinocyte change spread homogenously throughout the lesion. Again, the thing that's going to help you identify this as a seborrheic keratosis that's more inflamed or irritated is going to be that the cells are pretty bland. You don't see significant pleomorphism like you would expect to see in a squamous cell. So definitely need to have a high degree of suspicion when you see at low power that it looks like a seborrheic keratosis. You could have some areas of kind of necrosis in the center of the lesion, given the severe extensive irritation and inflammation that this lesion has undergone. And if you go to certain aspects of the periphery, you might lose your granular layer. It might make it a little bit difficult to call it an irritated seborrheic keratosis. So you really have to spend a good amount of time just to kind of interrogate this lesion to make sure that you're not dealing with a squamous cell carcinoma. So this is an irritated seborrheic keratosis with some component of inflamed seborrheic keratosis. Lastly, I'll mention another type of tricky seborrheic keratosis. This one, you can see that it's acanthotic epidermis, and as you scroll to the side, from side to side, you'll notice that there's these little nests forming. And to beginners, this could actually look like a melanocytic nest, but even to well-trained eyes, some of the cytoplasm here is pretty gray. It looks like it could be a melanocyte population. As you scroll across more, you'll notice that nesting phenomenon. Surprisingly, this is actually not a melanocytic lesion, and if you were to stain it with melanocyte markers, it would be negative. If you go on higher power, you'll notice that a lot of these nests have desmosomes in between them, which argues that it's a keratinocyte in terms of its differentiation. And what we have here is a clonal proliferation of keratinocytes that kind of spread across the epidermis, but without that significant pleomorphism or atypia that you would expect to see in a Bowen's or a squamous cell carcinoma in situ. So this is actually what we call a clonal seborrheic keratosis. These can often be confused with melanocytic proliferations or even a squamous cell carcinoma in situ. So it's good to be aware of that. And if it's in an answer choice on an exam, you definitely want to go in and look for those desmosomes in between the nested population of cells to really help you identify. In real life, we would do some immunostains just to make sure that we're not missing a melanocytic proliferation. And this doesn't look atypical enough to be called a squamous cell carcinoma in situ. So here we are dealing with a clonal seborrheic keratosis.